deputy sheriff told me this story. Told me about a young woman who worked in this small town at the local pizza parlor. She made minimum wage. She didn't get any tips. You don't get many tips at the pizza parlor. She sure didn't have health insurance. Well, she got pregnant. And she was having trouble, and she went to the nearest hospital. And I don't blame the hospital, but the hospital said, you know, we can't take any more charity cases. You'll have to come up with $100 before we examine you. Well, she didn't have $100. She went back home. Still wasn't doing well, went back to the hospital. They told her the same thing. Next time she went to the hospital, it was in the ambulance. And the doctors and the nurses worked, and they couldn't save the baby's life. Then they had to transport her by plane from where she was in southern Ohio to the nearest big town in Columbus to the medical center, where for 15 days the doctors and the nurses worked so hard to try to save her life, but she died. So I want you to think about this. Number one, it is morally wrong, in my view, that in our country a young woman and her baby would die because she didn't have $100 to get examined. Number two, think of this from an economic perspective. She didn't have $100. She wasn't examined. Who knows what it might have cost to make sure she was okay before she went home again. But by the time the baby and she died, hundreds of thousands of dollars have been spent. So you see, we're at a point where we have to change the way we finance healthcare for both moral and economic reasons. We spend more money than anybody in the world, yet we have 47 million people like this young woman who don't have health insurance. And we have millions more who have insurance, except when you really need it. And the insurance company says they won't pay for what you need. And then if you ever have that problem where you argue with an insurance company, you pay the doctor, you pay the hospital for what you require. So I have a better idea. You know, Congress has a real good plan for itself and for federal